Hey everyone, it's Dr. Hodges. I'm just about ready to go to work and I wanted to have two PSAs, so I'll make sure that I get this posted for y'all ASAP because there might be some potential changes happening in mid to late March on two fronts in medicine. The first is, I do surgical weight loss, but I also offer medical weight loss options. And of course, one of the things that I do is I really do like the injectables, the GLP-1s. Um, for my patients whose insurance covers the medication, I always use that. If they have an indication for diabetes, they'll get Ozempic or Mounjaro. If they do not have diabetes, then I will prescribe Wegovy or Zepbound, depending on insurance coverage. For my patients that do not have insurance coverage, and again, it all comes down to what your insurance plan is willing to pay for. I will use a compounding pharmacy. There have been several lawsuits going back and forth about compounded medications, and the FDA has finally just issued a ruling that tirzepatide and semaglutide, which are the generic names for um, Ozempic and Mounjaro, they just issued, as of March 19th, compounding pharmacies will no longer be allowed to compound tirzepatide and semaglutide. Now, there is another lawsuit that was just put forth. I think it was, I don't know the actual acronym, but it's the Association for National Compounders. That is in the works. However, I do not know. So what does this actually mean for our patient populations? I need to get final confirmation, but what it sounds like is that the FDA does not want compounding pharmacies to compound tirzepatide or semaglutide after March 19th. Now, Lilly, who makes Mounjaro and Zepbound, they were certainly one of the people that are a proponent of this, and they were fighting for this to kind of safeguard their medication. They actually have a direct to consumer I don't want to say hotline, but you can actually go directly to Lilly so that you can get vials of tirzepatide, but it is at a significantly higher cost than the average cost for compounding medicine. So I think it's close to $500. But that's just something to think about. So that's number one. There may be some significant changes for patients that are getting tirzepatide and semaglutide compounded as of March 19th. The second thing that is down the pipe, and I think that this is going to be kind of pushed out and overturned, is the federal government has chosen to extend, and this was as of the end of last year, but with the change in the administration, I'm just not sure what's going to happen. They chose to extend telemedicine coverage. So prior to COVID, the only people that insurance, when I say insurance, I mean Medicare, and typically commercial insurances like Blue Cross Blue Shield, Aetna, United Healthcare, that's what we mean by commercial insurance. They usually will follow suit with Medicare. Sometimes they'll change their guidelines immediately. Other times it takes a whole calendar year for them to make a change if Medicare makes a change. It all depends. It just all depends. However, Medicare guidelines are going to be changing if the government chooses not to extend telehealth coverage. So what does this mean? Prior to COVID, the only people that were eligible really for telemedicine were people that lived in remote rural areas that could not physically get to a doctor's office. Once COVID happened, they changed all that. Now, what I find ironic is that clearly it is 2025. So for the past 5 years, we have all been able to practice medicine completely fine with telehealth services. So I'm hoping that they can use this as kind of as a sounding board as to why we shouldn't just make that change permanent in Medicare guidelines. However, They have not as of yet. So, as of the end of March, so March 31st will probably, as it stands right now, will be the last day that Medicare will cover telehealth services. After that, patients will just have to pay a cash pay whenever they see their doctor. But stay tuned for these two big changes, because it could be a significant hit for our patient population. And again, the reality is that especially when it comes to telehealth, I have a lot of patients that are out of state. They haven't been able to get the care or find the doctor that they needed in their community. They've been able to get good care with me. And isn't that what insurance is for? Isn't that what all this healthcare coverage is for? Isn't that what the MAHA movement is for? It's to make us healthy again. So, powers that be, if you hear us, please extend telehealth, because it really is impactful for many of our patients. So, stay tuned. As those deadlines get closer, I will send more updates.